Thyroid cancer is one of the common type of cancers that are seen in the United States. Amongst the many cancers that we encounter, it is one of the ones that incidence is rising still. Fortunately, many of the thyroid cancers are well-behaved cancers, and I use that word very carefully because with appropriate treatment, cure, and long-term productive life is very much in sight. So we see a lot of patients who get identified with thyroid nodules. These are lumps that may form on the thyroid gland. Fortunately, a vast majority of those nodules are benign or non-cancerous, but some can be cancerous. In those circumstances, we carefully choose which patients would require surgery, and following surgery, a minority of patients may require additional form of treatment called radioactive iodine, which is a pill form of treatment. But generally, most of our patients tend to do very well. They live long, productive, healthy, happy lives, and that's our goal with them. So the thyroid gland is a butterfly-shaped organ that lives in the front part of the neck. It straddles the windpipe. It has two lobes, the right side and the left side. It produces hormones that regulate metabolism and hormones that interact with a wide variety of other organ systems. Disturbances of thyroid hormones can occur even without nodules or without cancers. Those are often medically treated, those conditions. Disturbances of thyroid hormone can lead to a wide variety of symptoms, which can span from very innocuous or very trivial issues related to skin abnormalities, nail or hair abnormalities, to more serious conditions which relate to how the heart functions and how patients have mental clarity and other similar things. Fortunately, most patients who have thyroid surgery, depending on the extent of the surgery, if they require thyroid hormone replacement, can be very well treated by way of pill form of hormone therapy. It is usually one pill that they take every morning. It is well tolerated. Labs can be checked periodically, but not very often. Once the thyroid hormone level has been in a fairly steady state, then the lab checks may not be more frequently than every 6 or 12 months. So patients generally do well with those medications. Most patients who receive a thyroidectomy are brought into the hospital on the day of surgery. They undergo surgery and then subsequently are observed for a few hours in a short stay area, and subsequently they are able to go home the same day. We encourage them to get up out of bed and sit in a chair, walk around normally. There is no requirement for bed rest. Patients do not usually have any restrictions in terms of their speech or in terms of swallowing. They can be on a normal diet afterwards. They usually don't require much in terms of pain medications. We've learned that most patients would have good pain control with medications such as Tylenol or ibuprofen and use of ice packs. So most patients don't even require narcotic medications. They get back to their routine lives fairly quickly. We usually don't use any drain tubes. The incisions are closed with dissolving stitches and some super glue-like material. Patients can usually shower the next day. They don't have to apply any bandages, and generally they bounce back pretty quickly. There are some minor precautions that we recommend. For example, just because if you have a neck incision and it's a little stiff and sore, maybe driving and turning quickly to look at the blind spot may not be easy to do. So I usually tell my patients that they may exercise caution for the first week in terms of driving. We usually advise them not to do any heavy lifting for 2 weeks. We expect and encourage them to return to their routine lives pretty quickly.